Good afternoon, class. The takeaways that I would like to share with you this week are related to the way we and our patients interact with healthcare websites and blogs and our views on consumer health informatics through social media and our mobile devices. First, I would like to focus on what metrics can be used by our clients to evaluate a healthcare website. From the guest interview with Chris Haas about healthcare websites, I could better understand how, for example, navigation is a big indicator since clients are expecting to find a horizontal navigation across the top. It should be easily accessed and fast to load. Another measures are, for example, ease to use, how information is presented by the user, and visual design, just to name a few. Let's take as an example WebMD, which is a healthcare related website that aims to provide valuable health information, tools for managing our health, and support those to seek information. I used to virtually live in this website back when I was in nursing school. Take notice that WebMD is a .com business, so they have sponsors and they depend on advertisement and corporate sponsorships to be able to keep on delivering great and useful content. Right from their homepage, the users can feel at ease. WebMD uses delicate colors as white and a very light tone of blue. They have a big search bar in the middle of the page that welcomes the user to type a symptom, a disease, or even a medication. All the information presented is backed up by medical professionals and by peer-reviewed research studies. If we go down a little bit, you can see trending videos and news as well as important sections linking the user to articles that talk about healthy living, dieting, etc. I honestly think that WebMD can be seen as a strategic website when it comes to patient engagement through health consumer informatics. Also by visiting healthcare websites such as healthfinder.gov, mayoclinic.org, and even the Centers for Disease Control and Prevention, cdc.gov, I could notice that Chris Haas was absolutely right. Blue and white seem to be the prevailing colors in all of them. Another key takeaway that also worked as an eye-opener for me is the fact that by reading only two research papers, Newman 2011, it's not that I don't have problems, I'm just not putting them on Facebook, and Hartzler 2011, Managing the Personal Side of Health, How Patients' Expertise Differ from Expertise from Clinicians. By reading those papers, I was able to further my understanding of the huge potential that online social interactions have for health improvement. Online health communities are growing and expanding every day. Shared in these papers are the strategies users develop to construct and then shape their online support networks, which now are widely known as Online Health Community or OHC. In these social networks, a simple common user, or put it this way, the least computer savvy user only types a few symptoms and asks for recommendation, and only minutes later he or she will have their questions answered. I cannot stress enough how important it is for a random patient that maybe had just been diagnosed with depression to know that they are not alone, that they are not crazy, that there is an online health community willing to share for free what is working for them, what medication, which technique. I think that above all the benefits of social networking that we can see through consumer health informatics, one of the most relevant ones is that it gives the patient hope and the strength to fight. Another key takeaway that I would like to share is that according to the Federal Communications Commission, there are roughly 293 million active cell phone users in the United States only, representing 93% of the population. The book Consumer Health Informatics by Thomas Wetter helped us gain some insight in the fact that mobile phones are basically a universal need. And by taking advantage of that technology, we can reach the least favored groups of the population, even individuals that cannot have access to internet. Short text messages of SMSs are restrained to only 160 characters. However, by using them, each and one of them wisely, we can convey a powerful point. A short text message can greatly reduce the incidence of missed appointments or can also let users know what is happening around them. For example, a community health fair of simply a friendly reminder to take a given medication. As stated in the book Whether, a well-considered strategy of educational reminder SMS can significantly increase adherence to a new medication in patients with a chronic condition and a history of low adherence. Thank you so much, class and doctor.